deep in the savannah of northwestern Ghana, remote farming communities surrounded by beautiful savannah landscape and friendly people. A very reserved and traditional region is faced with social and economic deprivation and an extreme lack of access to quality health care.
We were simply trapped in a sad and pathetic situation.
Depressing statistics of diseases, alarming death rate, especially for women and children, a failing primary health care system, the need for quality, sustainable health interventions was critical. Efficient development partnership, community ownership, gender considerations, and social behavioral change turned a once gloomy situation into a model region of excellence in the implementation of community-based health planning CHIPS strategy. The inspiring story of hard work, volunteerism, and resilience through the eyes of a daughter of the land. The dawn of hope, improving health services delivery in the Upper West region of Ghana. Before the year 2006, the Upper West region of Ghana was one of the most deprived and underdeveloped regions in the country. The region was known for its extremely poor health systems and very depressing health indicators and outcomes. The Ministry of Health established that more than 75% of the region's population had to travel over 8 kilometers to access basic community health services, and this had dire health consequences and economic burden on the people.
People did not seek health care promptly. They would wait until conditions was severe at the point of death, before they will start to make the initiative to access health care because of the distance and access.
Women who are pregnant and they want to deliver is always a problem, because you can't determine when the person should be in labor and to get to the health center.
We had quite a sizable number of deliveries conducted by traditional birth attendants because of the limited access to maternal and child health services.
In 2001, the World Bank estimated that 1 in every 225 women died whilst giving life in health facilities in Ghana. 1 in every 238 women died during delivery at health facilities in the region, whilst 1 in every 5 children died in the Upper West region before they attained age 5. These deaths were largely attributed to preventable causes, which included geographical barriers to basic health care, inadequacy of skilled personnel and equipment, among others.
In my community, like in many other communities here, we were simply trapped in a sad and pathetic situation. Sick people, children, adults, members of families dying of sicknesses and preventable diseases. I heard about pregnant women who died while delivering their babies and children who died shortly after their birth. My name is Gloria Domana. I come from Dafiema, a community in the Dafiemo-Bisei district of the Upper West region. My father was a mechanic and my mother a seamstress. At a point, my brothers had to drop out of school so I could complete my basic education. My parents simply could not afford to educate all of us at the same time. I saw abject poverty all around me while growing up. Many children could not afford to go to school, and many children and adults did not have access to quality health care. Growing up, I never wanted to become a nurse or work in a health center. I always wanted to be a teacher. I was afraid of the sight of blood and the fear of losing patients when caring for them. The constant sight of helplessness, the sadness that engulfed our communities those days, triggered my interest in becoming a health worker. When the opportunity came, I summoned courage and enrolled at JICA nursing training and qualified as a community health nurse.
I know Gloria for some time now. She has been a very hard-working girl. She is very passionate. She doesn't joke with her work. She's always punctual, and she's always ready to learn.
Ghana, in 2000, launched the Community-Based Health Planning and Service CHIPS strategy to facilitate improved health services delivery closer to the doorstep of community members, particularly to those at the rural and deprived communities. Under this initiative, community health professionals, supported by community volunteers, are trained to provide basic health care that includes maternal and reproductive health, child health services, treatment of minor ailments, health education, and promotion of healthy lifestyles, and follow up on clients after treatment. According to the Ministry of Health, the CHIPS strategy aims to increase community commitments and ownership in healthcare delivery, enhance access to basic health service, and promote local resources mobilization for health. Despite the successful launch and takeoff of the CHIPS strategy, it encountered immense implementation challenges and struggled to achieve its objectives.
My first step to facing the challenging reality of my dream commenced after completion as a community health nurse and deployed in 2013 to work in the PCA community of the West District. One of the most deprived, poorly accessed communities with high poverty intensity as compared to other parts of the region. Going on my first job posting was not easy for me. I had never been to a place I didn't know anyone, and it was a bit far from me. Working alone in this community with no basic amenities, such as potable water as well as limited availability of working logistics, made my professional journey as a community health nurse extremely challenging than anticipated. Initially, the community did not understand its role in the provision of health services. Patronage and support for the health services was extremely poor. There were limited numbers of CHIPS compounds, with very few nurses available at that time. Some of them believed in consulting a fetish doctor than visiting the clinic for treatment. Sometimes I get sad and almost gave up. I looked at the bright side. I was encouraged by the fact that I will help save lives and that I could help the community understand its role in healthcare better.
The Japan International Cooperation Agency, JICA, is an aid implementing agency that provides technical cooperation and other forms of Japanese official developmental assistance, ODA, to developing countries across the globe.
The government of Japan has a long-standing technical cooperation relationship with Ghana. Under the cooperation, the government of Ghana will usually make an official request of interventions that it needs in specific areas, and the government of Japan will respond to provide those interventions and help overcome the identified challenges.
The Japan International Cooperation Agency has very good bilateral relations with the government of Ghana, and that has led to transformational intervention in the area of health, agriculture, private sector, education, infrastructure, governance, and human resource development.
For about 6 decades, these developmental pillars are implemented through people-to-people connections established through human resource development as the foundations of trust between developing countries and Japan.
The government of Ghana, through the Ministry of Health, requested technical cooperation assistance for the implementation of CHIPS, and the government of Japan, through JICA, responded positively. The main objectives of JICA's intervention was to help improve geographical accessibility to quality community health services. JICA successfully laid a solid foundation for the takeoff of improved health outcomes.
JICA's intervention in healthcare delivery in the Upper West took a holistic approach. The intervention started in 2006 and focused on expanding access to community health services while addressing maternal and child health concerns. The support package had both soft component, which is technical cooperation, and hard component such as grant aid. The technical cooperation included technical training of health workers for effective healthcare delivery, improvement of operational efficiency through health system strengthening, community engagement, and public education. It also included improving healthcare delivery, social and behavioral change interventions, and equipment support.
The grant aid component included the construction of CHIPS compounds, construction of bridges over streams and rivers to facilitate transportation and access to healthcare facilities, provision of medical equipment and motorbikes for CHIPS compounds, and provision of ambulances and vehicles to strengthen supportive supervision.
Before the inception of the projects, the Upper West region had only about 24 CHIPS facilities, although a goal of establishing 241 facilities by 2016 was set. An ambitious goal for a region struggling to improve geographical accessibility to healthcare.
The government of Japan, through JICA, ensured the construction of 73 CHIPS compounds, equipping 80 existing compounds and providing motorbikes and vaccine fridges with other needed equipment. Currently, the Upper West region has effectively set up over 378 well-established CHIPS facilities with support from JICA and others.
Tabana namba dorona. Ye handowe. A city po. Ye pare nuru kuyamen.
So, ya baraka ya gaza. Chenye yele kanga. One of the major highlights of the success of JICA's intervention was the training opportunities I had under the project and the privilege to work with Japanese experts and volunteers. I learned best practices from them, and I also learned to be very diligent, committed, selfless, proactive, and timely to duty.
The project is not only to conduct some activities or intervention, but it is an opportunity to develop human resources.
I told myself, if these good people from other countries are here to help us develop our health systems, the least I could do is to support them. Supporting them means I'm also an agent of positive change for my people.
In initial stages, we had a lot of deliveries conducted by traditional birth attendants. After building the capacity of midwives, deploying midwives to the CHIP zones, we had to engage the traditional birth attendants to first of all appreciate them. But we started by saying that, can you always lead the women to us? We will conduct the deliveries, our midwives to conduct the deliveries.
Kampana, ya banyak katma ngaba da kudu. Sangan bade de kutun tentuna, kapaga pu mambiara ton dog hudu. Ya pambana nga, yala am tentanga. Kampana kapaga pu mambiara, saya ke tagalan ndokta. Ya ganun dokta ko mbanda ko. Hey, etra na din ga dokta kampana. Ba ganun dokta.
So at a point in time, traditional birth attendant deliveries completely declined. For now, we don't even have them. If they find a woman, they will call on a midwife.
The interventions through the JICA projects have helped strengthen the referral system by building referral linkages between the lower level facilities and higher level ones, such as the regional hospital. Timely and prompt referral has been institutionalized and enhanced. The provision of some 5 ambulances between 2006 and 2010 was a game changer, and that strategically facilitated the transfer of emergency cases from lower level facilities to higher facilities.
The Ghana Multiple Indicator Cluster Survey 2017 has established massive improvement in maternal deaths as well as deaths among children under age 5 in the Upper West region. 1 in every 1,337 women die whilst giving birth in facilities in the Upper West region, an improvement over the national average of 1 in every 324 women dying in health facilities due to childbirth. Children under 5 mortality rates have significantly reduced to 1 in every 16 children dying before attaining age 5, a massive improvement towards the national average of 1 in 18 children dying before age 5. These great achievements were possible through the carefully guided and well-structured interventions by JICA, Ministry of Health, Ghana Health Service, and other partners.
Tena pura anwa barkana Dr. Yirnyano Beate. First na katinon tapwa. Timanchang egbega tugo bi karaga jirapa. Atugo ye 8 miles. Kajirapa mi 8 miles. Amam ven la kati dewa halapa sor min dabasuma.
Through the project's community mobilization drive, communities, through their own initiative, have constructed about 43 CHIPS compounds as well as maternal delivery rooms to promote community health care delivery.
The community feels empowered through the regular debates between the community leadership and health workers. The community initiated the construction of a delivery room. The maternity and antenatal unit was constructed by the community people. They contributed money and labor to make sure it was completed. They also constructed the urinal for the CHIPS compound. This shows how well the community has been engaged and how well they are always willing to contribute to healthcare delivery.
There is nothing more important than the woman health. When you are not healthy, you don't have anything. So we came together. We tried so many ways to get a CHIP compound, but it wasn't possible. But after surveying the community, we realized that we had an abandoned classroom block. Then I told them that let's try and see how we can put that place into a good shape. The community cooperated. They agreed. They were happy. And now it is a place that for the time being we can be using there as our health center.
Yana obina dota che. Atun ko fen kan do be che akarate. Atun yel kan afro ka ho wa che ka betun wuti. Atitun nye yel efian kan ayi apo me.
Women in these communities form mother-to-mother groups to support each other and to promote maternal and child health advocacy and education. In complementing the efforts of the women, the men in the community are encouraged to offer father-to-father support groups to promote effective fatherhood and eliminate old gender biases hindering maternal health interventions.
Tini father-to-father support group nga te sunne tinanye adota nga na wosun tin yaga ti meet na kuyere ka banan wane mpoko che ko doru guro te ma sunla a eletena na e ka porta adota kumpo ado so ana minti sunobala le ka tin lawa aye po meteman karala.
Most importantly, more people across the region, in villages and small communities, now have access to basic health care. Our health indicators have improved significantly. Our people are more aware of the need to seek health care and they can access at their locality.
As members of parliament from the region, we supported the project right from the beginning because we saw the suffering our people were going through. The results of these interventions, spearheaded by our development partners on the quality of healthcare delivery, have almost been immediate. We have seen tremendous improvement in the region's primary healthcare system, and as major stakeholders, we commend and complement these efforts towards improving health status in the region.
In line with the Ministry of Health's vision of achieving universal health coverage and ensuring healthy living for all, the JICA support to the Ghana Health Service is focused on consolidating the gains achieved so far and focused on providing quality and essential health services using the life course approach. This approach prioritizes care for all age cohorts in the society. Everyone is being educated on lifestyle diseases and how to prevent them. We have interventions such as the JICA daycare for the aged, adolescent guidance and counseling sessions, and many more.
With the improved health system supported by JICA, government and other development agents, we have seen an evolving and sustained healthy population that drives productivity for economic development. I say a big thank you to JICA for laying a solid healthcare foundation in healthcare delivery in Ghana.
Since 2006, the project started, and I am the only person who are still working for this project now, which is now in the phase 3. I'm very grateful is to be able to see the development of the country and also human being.
I'm grateful to my parents and siblings for their sacrifice to ensure I become a nurse. I am very grateful for the intervention of JICA. Healthcare in Upper West is not the same as it used to be. As I now work in this big regional hospital constructed by the government of Ghana as a tertiary health facility, I know patients could be referred from any part of the region and they would get access to quality health care.
The experiences and key lessons from the CHIEFS project have been reflected in guidelines and policy documents to guide the sustenance and scale-up of these interventions. We greatly appreciate the support of JICA. These supports have been things that the nation needs, and they have systems and support systems that are focused on the poor and the needy, and we are ever grateful to them for the support.
Sustainability is key in JICA-supported project. Hence, project experts, Japanese volunteers, and Ghanaian officials work closely to facilitate the transfer of knowledge and skills, leading to the ownership of intervention. JICA remains committed to supporting the government of Ghana in achieving universal health coverage by scaling up these novel interventions from these projects across the country.
With the project already in its third phase, the positive impact can be felt in all parts of the region. The government of Japan, through JICA and its partnership with the Ministry of Health in Ghana, continue to provide health interventions, empower the people, and offer hope for better health service delivery. A solid foundation for improved quality of life has been laid. A new dawn for effective community health service delivery in Upper West region of Ghana has arisen.